Hello everyone. Today's video is about a couple of different questions that were asked on some of my other videos. One's about the effect of nebulized glutathione, whether it affects the whole body or just the lungs, and then the other is about why a person might have a positive response to a second generation antihistamine and not to a first generation antihistamine. So I'll jump into the questions here in just a second. Just as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So the first question kind of gave the person posting the question, gave a bit of a health background. The person was diagnosed with Lyme, SIBO. I think maybe I remember mold in there, maybe not. Anyways, the question ultimately distills down to the following. One question I have is about glutathione. You mentioned how important detox is. I'm taking Tri-Fortify glutathione, which is a research nutritionals product for reference. So taking that daily, but also nebulized glutathione daily. I tend to be prone to chronic pneumonia. Does the nebulized glutathione only help the lungs, or does it help detox and support the whole body? So thank you for the question. So to my understanding, nebulized glutathione does not meaningfully get into the circulatory system. It doesn't meaningfully jack up the levels of glutathione in the blood, and it is really just for the lung tissue. I'm trying to remember off the top of my head at one of my supervisors in naturopathic school, if memory serves, actually wrote a paper or co-authored a paper about nebulized glutathione and its pharmacokinetics and things like that, kind of where it distributes in the body. And my recollection is that this has actually been looked at in research setting and that it does not meaningfully get into the bloodstream. Now, I might be remembering that incorrectly. I did not double check the research literature before posting this video, so please do not take that as gospel truth. It's just something that I seem to recall there might be some research literature showing that it does not get into the bloodstream. What I can say clinically is that when folks use nebulized glutathione, I don't see it having a clinical impact the way that I see, say, intravenous glutathione or a really a good form of liposomal glutathione that would actually get into the bloodstream. However, if a person is taking a good form of glutathione, like the Tri-Fortify glutathione, then that would get into the bloodstream in a meaningful way in the majority of cases in my experience. So nebulized glutathione, good for the lungs, probably doesn't really do a lot for the rest of us in terms of the rest of our bodies in terms of glutathione. So thank you for that question. And then the other question was about the antihistamines. So the question was, what does it mean if H1 blockers don't work, but H2 blockers do? Now, as I'm reading this over again here, I realized that I had my wires crossed when I first read this at first glance. I was thinking, with the 1 and 2, I was thinking first and second generation antihistamines. So never mind. Scratch what I said at the start of the video. It's not about first and second generation antihistamines. It's H1 blockers. So so an H1 blocker would be things like Reactin, also known as Zyrtec. Both of those are the generic name for that is cetirizine, or it would be other drugs like diphenhydramine, also known as Benadryl. So those are your H1, like histamine receptor type 1 blockers. And then H2 blockers, those are medications like Pepcid AC, also known as ranitidine, would be another common name of that. Cimetidine, I believe, is another one. So a person's asking, H1 blockers don't work, H2 blockers do, and specifically that's for symptoms of daily hives and a high heart rate as well. So hives, classically, folks would know that that's associated with too much histamine. Elevated heart rate is also something that can be associated with too much histamine. So the person asking the question sounds like they're probably dealing with mast cell activation syndrome or histamine intolerance or a combination thereof. So thank you for the question. So it's a really good question. Because, of course, it's counterintuitive. We would generally think that the H1 blockers would work better because that's ultimately what typically will drive those type 1 histamine receptors are typically what are going to drive hives anyways. And then with the high heart rate, antihistamines in general tend to be helpful. So at the end of the day, it's just yet another example of there's no one size fits all for everyone, and the proof is in the pudding of what helps. So I've had patients in the past where they'll respond to something that won't respond to something that oftentimes help, and they'll respond to something analogous that helps more than the thing that usually works. So at the end of the day, if it's working, that's great. But why might that be the case? So again, not giving any medical advice here, just kind of speculating here because I don't think that I've had any patients to date where they have found that H2 blockers work better than H1 blockers. As a point of interest and of some degree of relevance to this question, some patients do find that when they're taking their H1 blockers, like say their Zyrtec, their Reactin, their Benadryl, whatever it is, and it's working somewhat, and then they add in an H2 blocker, so they'll start say taking some Pepcid AC, then it can work better because there actually is some spillover between H2 blockers do spill over and block H1 receptors to some extent. So there is like kind of a synergy there. Also, by blocking multiple histamine receptor types, it will have a net sort of lowering effect on the overall amount of histamine activity happening in the body. As I've mentioned in other videos before, one of the unfortunate things with histamine is that the mast cells that release histamine, they have receptors on them for histamine itself. So the more histamine in the body, the more histamine gets released. More histamine gets released, there's even more histamine released because the mast cells getting activated by that histamine, and it's just this vicious cycle or this kind of accumulating phenomenon that happens. So sometimes just blocking as much histamine receptor as possible is a good winning strategy. Again, not typical that the H2 blocker would do all the work and the H1 blocker wouldn't help, but that could be, the H2 blockers could be helping in part because for this person's, for given case, there's maybe more activity or interplay of the H2 blockers than the H1. The other theory that I have around this question is there are some folks where their histamine trigger is very much dietary mediated. And so it may very well be that an H2 blocker is working better for someone because when they have that kicking around in their system, there's not as much of an activation of histamine receptors related to food. So it might have to do more with that. So when we eat, there's a release of histamine in our stomachs, and then that histamine, and the reason for that release of histamine is because it's involved in stomach acid production. So we need things like histamine and serotonin actually in the stomach to actually tell the parietal cells to start releasing more acid to break down the food. So there could be a scenario where a person is, eating food, then that histamine is released, it activates those, binds to those H2 receptors, and then that just adds to the overall histamine activity in the body enough to start jacking up those histamine levels overall. So by taking an H2 blocker, then that would help to interfere with that whole cascade. So that would be my best theory as to why that's happening. But again, I haven't seen this in my own patients before, so I just figured I would add some thoughts to the equation. I, again, went into this video thinking that it was about first versus second generation antihistamines, which also would have been weird if, first generations don't work, but second generations do, because first generations tend to be stronger. But anyways, these are my thoughts on the fly, and that would be my best theorizing around that. So if anybody watching the video happens to know of a better answer, or if you yourself or someone has found that H2 receptor blockers have worked better than H1 receptor blockers, and you've been given a better explanation as to why that might be the case, please feel free to post in the comment section below. I'd like to know about it, but those are my best thoughts at this time. So again, thank you to both folks who asked these questions. If anybody has any questions about these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.